Dear colleagues, thank you for the invitation to take part of the 36th Great Wall International Congress of Cardiology and Asian Heart Society Congress 2025. And the opportunity to give my presentation. My name is Rano Alieva. I'm from Uzbekistan. I'm working at Laboratory of Chronic Ischemic Heart Disease and Atherosclerosis. Today I will be speaking about arterial hypertension in Uzbekistan. Uzbekistan is a rapidly developing country, both economically and demographically. After the years of independence, the population of the republic has growing 1.5 times among the more than 36 million people. Along with positive demographic change, the incidence of mortality from non-communicable disease, which included disease of the circulation system, is growing. In 2019, NCD cased 33% of all deaths in Uzbekistan. In the overall structure of cause of death, cardiovascular disease take the first place, and now it was 63%. Many such as ischemic heart disease, arterial hypertension, and their complications like myocardial infarction and stroke. Mortality trends in Uzbekistan of this period from 20 years growing from 98,000 in 1918 to 220 in 2024. But according to expert forecast, these annual trends will continue and reach 631,000 per year by 2100. 19% of risk of infarction is associated with 9 modifiable risk factors, including such abnormal lipids. Such as abnormal lipids, high blood pressure, smoking, hypertension, diabetes, abnormal obesity, and consider with the pure prospective urban-rural epidemiology, finding data from Global Cardiovascular Risk Consortium, which suggests that strict control of just 5 modifiable risk factors could potentially prevent 57% of cardiovascular disease cases in women and 52% in men worldwide. Air pollution is one of the most dangerous risk factors for cardiovascular diseases and mortality. Air pollution has recently also been contribution as a factor of the risk of general morbidity and mortality from cardiovascular disease. And the prevalence of hypertension among adults continues to grow worldwide. And according to World Health Organization forecast, by 2025, the number of patients with hypertension worldwide will reach 1,055,000,000, which will be 29% of the adult population. Identifying the most common risk factor and control the spread of NCD are prerequisite for building approach effective health sector strategies and planning activities to prevent and control NCD in the population. So the end of the study was conducted in Uzbekistan from July to September 1918 to study the prevalence of NCD risk factor based on World Heart Organization STEPS methodology, which included 3 main strategies. A survey were responsible in order to collect socio-demographic and behavior data, like a physician examination, such as measuring height, weight, blood pressure, pulse rate, and total coverage of the study was 88% of the planned number of responsible according to the results of STEPS 2019 study. Identification of risk factor for cardiovascular disease was analysis, and particularly it has been related that 38% of country residents aged 18 to 69 years, including those taking antihypertensive therapy, and the last month have high blood pressure at the level more than 114 in systolic blood pressure and more than 19 by diastolic blood pressure. 16% in that population have country of currently customs on various types of tobacco. 16 country population consumes less than 5 servings of fruits and vegetables per day. More than third part of residents always or often add salty sauce on their foods before eating, eat directly during meals, and more than third party of residents always or often consume processed foods with high salt content. And more than 32% of population are overweight, and 23% are obesity. More than half men and women have abdominal obesity. To achieve 15% of blood pressure control, in an additional 21 people with hypertension need to be effectively treated. If a possible scenario for progressive in blood pressure control is achieved in the country. More than 157,000 deaths could be prevented by 2040. According to the last data, more than 3 million people lived in the ecological vulnerable RLC region in Uzbekistan. As a result of the drying up of the RLC salt and dust storms frequency occurrence to the Republic of Karakalpakstan and Kharazm region, leading to environmental degradation and adverse health effects. The RLC disease has particularly serious impact of the health to the location population. According to the President Decree number 103, starting from 2022, preventive examination for the population aged under the 40 years have been organization with the assessment of the health profile one time a year conduction target screening. The cardiovascular disease patients treated coverage tangent and timely high-tech intervention past 4 years, and amount 10%, the second half of the 2023 amount to the 53%. The study was conducted in Lika district. The result of screening of population under 40 years, we do the HUPEN protocol, screening which carried by visit and nurses. The study did not include patients with cardiovascular disability, and cardiovascular risk was calculated using a mobile calculator according to the World Heart Organization PEN protocol, according to which the 10-year risk developing fatal and not fatal cardiovascular disease was green, less than 5%, yellow color 5-10% of risk, and orange color more than 20%, and more than very high risk more than 15%. For identifying additional risk factor, the target organ damage echocardiography was performed using conversation method with the echocardiography, and we determined the thickness in intima media complex, common carotid artery, and making into RLC region characterized by unfavorable diet and salinity of soil and water, or patient underwent the test. according to Henkin method to determine the threshold for table salt test sensitivity by applying natri chlor solution and increase concentration drug drop to drop to the anterior third of the tongue. The RLC desire has negatively impacted. It has led of the spread of the disease such as anemia, respiratory cardiovascular disease, as well as increased infant and material mortality. Over the past 20 years, 16-fold, while the incidence kidney and liver disease has increased severalfold. Theoretically, given the during up the RLC and formation of the zinc salt layer, it is possible that salt particles migrate with the sandstorm and pollute both the salt and water, leading to increased salt consumption to the local population. The important high table intake, a risk factor for cardiovascular disease, was demonstrated in many epidemiological studies such as INTERSALT. In our study in family clinic setting, we used the extending method for determining the thresholds of high field salt testing using our method. Our results showed that incidence of high salt sensitive threshold and accurately linked in hypertension patients in RLC region. As a result of screening 1,020 patients with blood pressure more than 140/19 we included in the study, which considered 41 of the sample population, and men and women about 61%, men 38%. Among studied patients, the new diagnosis of hypertension included in the study was 31% had previously have been diagnosed with hypertension. But their blood pressure was not controlled, although many of them were taking antihypertensive therapy. Our results demonstrate pronounced this degree of left ventricular hypertrophic and high prevalent more than 96 in hypertensive patients in the RLC region. And additional factor risk of target organ damage showed that the myocardial hypertrophy and high level of albumin category was suspected higher in this population. And I would in conclusion, and particular recommendation of our study was implement the HISINX test, sensitive test of the pre-physician offices in simple, low-cost screening tool for salt-sensitive hypertension. Second, straight the role of community health nurses, they effectively conduction home-based screening and risk stratification. And this dispensary, the follow-up poor adherence is major barriers to control. 4, used fixed dose combination antihypertensive therapy to improve blood pressure control, and continue reached on the impact of environmental factors like soil, water, salinity, dust, storm on cardiovascular health in the RL region. And I would like to say thank you for our colleagues and administration of Elika District's Territorial Medical Association, family doctors, visiting nurses, and entire staff of family clinician of assistance in collection data and conduction research. Thank you very much.